Please welcome David Rubinger, Market President and Publisher, the Atlanta Business Chronicle, and Dr. Deborah Arory, Deputy Director of Program and Science, CDC.
Good morning, everybody. Yeah, that's better. Antrell, thanks for warming up the crowd for us. We really appreciate that. And to the governor, I mean, isn't it nice to have two opening acts like that?
Tremendous.
It makes life a lot easier. Welcome, everyone. I want to take a quick moment to congratulate Russ once again and the whole Health Connect South team for putting together an incredible program, filling this room up once again. Doing this for 10 years is really quite an achievement. For those of us who know Russ, we know he puts his heart and soul into this thing in a way that very few other human beings could ever do. And to his entire team, he's really, the passion for this topic, this whole idea of healthcare collaboration in space is really tremendous. So I think, let's give Russ a round of applause. But we're not here to talk about Russ, we're here to talk about you. So, Dr. Deb Howery, we did this last year, we're back again this year. This is a discussion really talking about, one of the things I've been impressed about the CDC over the last decade is not only how far y'all have come in so many different ways, but the way you've also connected with what I consider to be the Atlanta way between the CDC and the CDC Foundation. Y'all are definitely part of this community in a special way. You were talking about your leadership Atlanta reunion last night. I just love the way that
Best class 2013.
Class, yeah, 20, as opposed to class 2000, which is okay. But the way that CDC is connecting with the Atlanta community in a special way, given the fact that you have this global mission. So those of us who are involved in the Atlanta business community really appreciate the fact that CDC is so involved with everything that goes on here locally. But before we get into sort of substantive stuff, I want to talk to you a little bit about your background, being an ER doc by training, but also what does a day of a deputy director look like for the CDC? Because we all know the title, right? But what does this woman have to deal with on a daily basis? What does a typical day look like?
You know, I'd say fortunately it harkens to my ER roots because every day is different and there can be a little bit of chaos. Occasionally there's quiet. You know, just thinking back to like a day last week, we're still dealing with malaria, you know, domestically. So that was one of the things in my portfolio is talking with a lot of our health officials locally around how are they tracking it? How are we responding? Do we have good mosquito sprays? Then on the flip side, still also dealing with health issues from the East Palestine train derailment, also in my portfolio. So talking with the communities, tracking how the community is doing. I also review every single morbidity and mortality weekly report article that comes out. So I spend the day, you know, always making sure that now we're being much more concise with really kind of a bottom line up front on our science. And then usually I sprinkle in a media interview or congressional briefing throughout the day as well.
And I know that's the favorite part of your day is when you're dealing with the media. We appreciate that. You're actually really good at it too. That makes it really good. So what makes someone with an ER doc training an effective leader, especially in moments of crisis like this? What are some of the telltale signs that someone who comes out of an emergency room can do what you do?
You know, I think it's because in the ER you have to be team-based. I learned that the student, the EMT, the nurse, the trauma surgeon, we all have a really important role to take care of the patient, and you have to listen to everyone from the different disciplines and different backgrounds. I'm also comfortable making quick decisions with a little bit of information and changing as needed. And then I think I have mastered the art of triage. So the 300, 500 emails I get a day, I can prioritize. I also think ER docs in general are just kind of fun.
Yeah, you have to have a sense of humor exactly. in those tough moments.
Keep it real. I think it's the other thing is, you know, I try to see patients when I can to always have that link to what is the impact we're having on the community.
Got it. Let's move on to some you didn't mention COVID in your portfolio, but obviously COVID is on the mind of everyone. I feel like over the last couple of months, all of us in this room have heard about someone saying, oh yeah, I've caught COVID, or I got COVID again. And now we have the new vaccines rolling out again. Now that we're coming to this next wave of COVID, what are some of the, thinking back over the last couple of years, how do you feel the CDC is doing this time around in preparing society for the fact that COVID hasn't gone away? What are some of the issues we have to deal with around the COVID vaccine right now?
So I'm sure I'll hear on the break from everybody their thoughts on it, but what I would say for my thoughts on it is we're trying to really be upfront about what we know, what we don't know, and what's coming when it comes to COVID. And we're also trying to make sure people realize, one, it's here, but we also have RSV, we also have flu. And so when you look at our website now, we post data on all three. So you can see where it's trending, because let's say we have a really bad flu season. That's going to impact COVID hospitalizations and everything else as well. So we have to have that big picture. We're also trying to share information as quickly as we can. We have a blog now that we started because one of the new variants, but then we've been updating it on other aspects too, like tracking flu in South America. So trying to simplify too, our vaccine messaging that came out last week. I encourage everybody 6 months and older to get your updated COVID vaccine, and that's the message.
Right. Is the message to get the COVID vaccine and the flu shot together, or is there any guidance on specifically that piece?
So co-administration is fine. You can get them both together. Some people want to do them separately. As long as you'll go back for your second shot, it's fine to go back for your second shot, but it's just as fine to get them both at the same time.
And supply of the COVID vaccine there's plenty of stock?
Yes.
Okay, because it's just starting to roll out now. Some places have it, some places don't. It's starting to ramp up appropriately?
It should be everywhere. One of the things that CDC did is we have a bridge program that's covering uninsured. And so we're working with CVS, Walgreens, and some other pharmacies to make sure that it's there. And so we're also tracking how many vaccines are given, too, to see what parts of the country are ordering if we need to provide more technical assistance, so tracking it closely.
So, and well, you talked about the uninsured piece. That's been the headlines today. Do you feel confident that the uninsured, the availability of quote-unquote free COVID shots, is that something that CDC worries about, and how do you guys look at that issue?
You know, what I would say is right now we know we have ample supply, and we have the bridge program that's funded for at least a year to provide that. So I'd say we're in a good place today.
That's all we can ask for at this point.
I take it a day at a time lately.
Right. I totally get that. So this is all about collaboration, right? First of all, I feel like everybody in this room has a story. I feel like we could literally go from table to table and hear about every different startup that has, and it would keep the Atlanta Business Chronicle in business for years, because there's so many great stories. I already heard a couple when I came in this morning about people who are doing amazing things, whether it's in the clinical side or the advisory side. We have all these great students who are probably, I know y'all are going to kill it. So I'm just excited about where you're going to be going in your careers. But this idea around collaboration is such a key ingredient to it, and it's what's going to help. It helps the CDC tremendously. So when you think about business, political, and healthcare leaders outside of government, where do they best help CDC accomplish its mission?
I think a few things. One is carrying messages. Like if we're talking about vaccination, making sure you're getting your employees, your staff vaccinated. There certainly has been some misinformation the past few years. You can help with that. People listen to you. So really the more you can provide the data, the science, the facts, that helps. And then when I look at like the Atlanta community, some of the innovations like with CHOA and Georgia Tech around pediatric engineering, because you know children aren't just little adults, and so how do you really modify things? And so looking at how we can learn from technology, universities, and we're your neighbors. You know, CDC employs 10,000 people in the state of Georgia. So we're around you. We're one of the largest employers. So we're your neighbors, your friends, your colleagues. We welcome the collaborations, and you know we're trying to be out in the community more, looking at the different programs. So feel free to invite us to your conferences and vice versa. We look forward to learning from all of you.
Taking a half step back, when you talk about communicating, you're a really great communicator. You've had good people working around you to help you, prepare you with your communication skills. Some of the things you have to communicate are unbelievably complex medical or scientific data points that when you're trying to put that out to millions of people, that is a real challenge, because as I know as a journalist, everything can be open to interpretation. Your words get minced.
Yes.
What are some of the keys when you're communicating, and this is something that we all can learn from, what are the kind of the keys to successful communication that you think would help everyone, especially when you're dealing with complex topics? And in this room, I bet if I asked about half the stories, I'd have to ask you all to take a step back and, dumb it down for me because I wouldn't get it. What are some of the keys to effective communication at getting your point across?
One of the things is, I think, truly when you think about risk communication, what do you know today? What don't you know? And then what are you going to do to close that gap? I also think, and it's not dumbing it down. I'm going to share a personal story. I went through a fellowship before coming to CDC, and it was where you're paired with a journalist, and they help you write op-eds. And I had written hundreds of papers and grants, so I thought I was a good writer. And I asked for feedback because she wasn't quick enough because I'm an ER doc and everything always has to be fast. And she just said, it's taking me a while because you're not a good writer. And I said, what do you mean I'm not a good writer? And she said, you're jargony, you're trying to get too many points across, and you're just filling it up with data. She's like, pick 1 to 2 things, key messages you want people to get. And so that was one of the things I really took home was, if I'm going to give you 10 data points, people aren't going to remember anything. 1 to 2 things, and where you can, what's the face to it? What's the story? That's what people will remember.
Yeah, I think that was the first thing I learned when I got into journalism. The reason why I got into journalism was I wasn't a good writer. And it taught me the skills of having to dissect information and get it into 3 concise points that people will take away, and repeating those points over and over. This is all the basics of media training, but there's a fundamental human nature can only absorb so much information at one time. But if someone's really interested in those 10 data points, they'll want to dig deeper.
They can find them.
They can find them, they can dig deeper, and it works very well. I want to shift a little bit over to a different topic, and we've talked about it last year, but it's still so important. The whole idea around mental health and substance abuse in the public health dialogue, and where the CDC finds itself being the most effective voice in this topic. And it's also one that obviously takes a ton of collaboration between the public sector and the private sector. So tell me where the CDC's role is right now in this whole mental health, substance abuse conversation, and let's just talk about that a little bit, where things are right now.
So unfortunately, things are getting worse. We saw things going up pre-pandemic, and they continue to go up during the pandemic. One of CDC's roles is to really collect that data, and so we've been able to get it out much faster than previously. And in fact, I was proud of the work done at CDC, to where the National Center for Health Statistics and the National Center for Injury Prevention and Control were working on papers around suicide. I knew I had provisional data coming out, and New York Times would always publish it before our papers came out. So I said, let's do something different. Let's put out just a press release with the data on the website for everybody to access. And we did that. Right. It showed an increase, though, particularly in middle and upper age adults for suicide deaths. There was a slight decrease in youth, but in my mind, that's not a victory. That was a single data point, and we need to make sure that trend continues, that we're continuing to focus on youth mental health. With drug overdose, we're seeing a slowing of increases, but with fentanyl analogs out there and xylazine, which is not responsive to naloxone, again, can't declare victory, have to continue focusing on prevention and harm reduction. So that's the data aspect that we collect and put out there so communities can respond. Then we work with communities and states to say, here's what your community looks like. Here's where you can focus this community, more public messaging, work with public safety, make sure that there's naloxone out there. This community, we're checking syringes, and we saw that there was actually xylazine in 60% in this one community. You need to really be working with some of the harm reduction groups. And then this other community, let's focus on the youth and the kids, focusing on a lot of the primary prevention. So we use evidence-based strategies and work with communities and states to implement them, but we can't do it alone.
Right, so when you're talking about the private sectors, what have been some of the most effective things you've seen coming out of the private sector towards are there any small victories we can think of where things have gotten a little bit, I know it's getting worse, but have been any things where the private sector has been most effective at tracking, identifying, helping?
Yeah, so in a tickler for next month, we actually have a vital signs coming out on health worker mental health, which I think will be of interest to this group. In there, it talks a lot about what businesses can do. One of the things I would say is we're seeing a lot more naloxone that businesses have. And I think the more that businesses destigmatize mental health and substance use, allow for time to go for an appointment, whether it's for mental health or substance use, don't ask employees to always disclose if they're in treatment. That can really cause a lot of stigma. Similar things when you look at people don't want to ask about suicide. And the more we can get businesses and communities to ask about suicide, it doesn't mean somebody's going to be more likely to die from suicide. If you ask, they're actually less likely because they know that you care. So I think it's, and as we heard, the 988, I think that's something, the more you can promote that through your businesses and communities, that's extremely helpful. So what I'd say is with businesses, the more that there is access to medical care for mental health and substance use, looking for signs and ensuring that you're linking to care, trying to minimize stigma as much as possible and supporting people, and then having a healthy work environment. You've got to build that in that resilience, that work-life balance, the appropriate staffing. Those, can be risk or protective factors. So if you can really buffer up front, that helps as well.
You mentioned how the healthcare community faced some of the biggest challenges.
Yes.
I actually spoke to a hospital CEO about this last month, and we got into a long discussion about that is the number one problem that this institution is facing, is dealing with this silent issue that's going on within their organization. And they're the ones who have access to the medical care. They live inside a hospital, yet they're the ones, this is the classic cobbler's children analogy of why can't they overcome it more than others? What's going on within the hospital community that's keeping them from being able to identify it first and be out in front on this?
I think part of it is the barriers, and one of the things that I've spoken about is, I think when I renew my license, I have to put if I've been in treatment.
Right.
That's going to discourage people from being in treatment because they have to disclose that. Lorna Breen was a fabulous ER doc who died by suicide during the pandemic because of all the stressors, and Congress has passed some legislation now to fund really resilience training, mental health awareness in doctors. And I think also as a doctor, I think back to some of my days in the ER. I would see horrendous things, come home, put on a good front, take care of my kid. Right. So I wasn't able to take care of myself enough, and I think sometimes you don't realize that you need those supports. And so I think the more that we can first thank our healthcare workers for the heroic work they do every day, and then allow them that grace to seek the treatment they need.
Right. And I mean, and you wonder, I think about my own young adult children and their friends. A lot of them are like, great science and math kids. I'm like, hey, you want to become a doctor? No. Why not? Well, I saw the struggles that my older friends have had being young residents in their 20s. I don't want to give up my 20s. Oh, so I'm going to become a nurse practitioner or a PA because I think that's an easier route, and I'm not going to get rid of my life. We have to get the medical profession back in a place where it's something you want to do and not feel like it's going to destroy your own personal life.
Yeah, and what I'd say is nurse practitioners and PAs are also on the front lines. And
Sure.
One of the other things that I think we saw during the pandemic was heightened stigma against all of the providers because are they carrying COVID? And so they're saving us, but also people didn't want to be around them at one point. And there's also violence that they experience. And so I think just having more policies in place in the healthcare systems to really support and protect our staff are important.
So I'm going to go from a really difficult issue to an even more difficult issue. And there's no easy answer to this, but the whole idea around the topic of social determinants of health is such a hot topic. If you don't have access to quality food, you're not going to lead a healthy lifestyle. If you're not in a home setting that is conducive to healthy lifestyle, if you're not breathing clean air, all these things are the social determinants of at the end of the day, these are the things that cost our society billions and trillions of dollars. So where does the CDC fit into that? Because it's a really complicated issue. And can the CDC own it?
I don't think the CDC owns it. I think all of us own it. And I think, what CDC can do is we can convene. We can bring stakeholders from different sectors together around it. And we can raise up what are the issues, like you mentioned, around some of the social determinants and the health impact. So if you don't have access to transportation, you can't see your medical appointment. So you're going to miss dialysis a few times. You're going to come in and, florid renal failure. So with more complications. If you didn't have access to early childhood education, your opportunity for a good job and health insurance is impacted. So all these health determinants, I call them like the building blocks of health, are really important. And if you don't have a place to sleep, you're not going to be worried about filling your medications. So the more that businesses, sectors, all of us can look at ways to support affordable housing, some of the work-life units, early childhood education. I've seen some tremendous examples of businesses supporting early childhood education for their employees. And then certainly supporting things like urban gardens and ways to have access to healthy foods are important. So this is something I hope all of us can tackle together.
And this leads also to the broader, there's been a lot said about having a more diverse healthcare workforce. It will help in this whole delivery. I mean, the trust that an individual may have in their healthcare provider would help a lot if it was that person, they could relate to that person. So where does the CDC want to try to be part of that dialogue? I know Dr. Montgomery Rice talks about it a lot, and she'll be speaking.
She was in the class of 2013, by the way.
Yeah, that class was pretty awesome. I will say that. She'll be talking about that, I'm sure, in her panel discussion. By the way, you guys have such an amazing agenda today. They're all great panels. Tell me where the importance of the DEI piece, and where can the CDC promote diversity within the ranks of public health, and why is that so important to getting where we need to get to?
Well, I hope you all tune in to the health equity session later today because we have a fantastic CDC scientist, Leandris, who will be talking about it a bit. What I would say is we know that it matters. There was a Journal of American Medical Association paper that came out a few months ago, and it showed that for every 10% increase in Black physicians, there were decreases in mortality and morbidity in those communities. So we have the data. It's something that we must really focus on. When we're looking at it at CDC, we also know that if we have somebody like me that goes out to a rural community, they're not going to listen to me or understand me as much. I don't come from that community. So we're looking at more leadership programs and fellowship programs like AmeriCorps, the PHAP program, to where we can get people in the field from different communities, optimally going back to those communities to support them and grow. And we also started a new leadership program this year where people could self-select in so that we can really grow people equitably at CDC.
That's great. I'm going to start pulling the lens back out a little bit. The most challenging part of your job, and for any of the CDC leaders, is everything that's happened at the CDC over the last several years. Tell me about transformation within CDC. What has it been like for you? I mean, I'm sure it's like trying to change the tires on a speeding car going down the road because it's so hard. You have to keep doing your mission, but you're always also trying to do this type of transformation with different leadership, different people coming in and out, all that. Tell me how that has gone. What have been the fun parts? What have been the challenging parts? How's that all come together for you as being part of a government agency?
Super easy question.
Sure, of course.
I think back, I spent 7 years running the Injury Center first at CDC, and there I had a lot of lessons learned. I led a reorganization. I quintupled the size of the center too while I was there, so significant growth, but then also we needed to change to really address some of these emerging needs. What I learned most was we needed to hear from staff. If I made all the decisions, I didn't have all the answers, so we needed to hear from those that were on the ground and to really allow innovation and failure. Right. And so that's what we're doing at the agency level. We started CDC Moving Forward over a year ago, but to be quite frank, we are starting to do a lot of these changes beforehand. Mm-hmm. And so we're asking staff to help tackle it. So one of the things we've seen is people talk about our scientific clearance times. So instead of doing it one by one, we're now doing, concurrent reviews. We're also limiting the number of reviewers and focusing on more deal breakers versus commas. And what we have seen is clearance times decrease by about 50%. We've also looked at empowering people to say, we can't do everything all at once, so what can we take off of our plate? And I think one example is we're looking at different pathogens. We don't have lab tests for every pathogen in the world. So what are the ones that are most likely to spread throughout the US that don't have treatments, and how do we develop tests for those first? And so really starting to think through what is the order. We have a suggestion box, and I get every single suggestion that comes through, and then also goes out to the centers and offices that I supervise, and we expect responses and for people to understand them. I also think you have to have a little bit of fun, and so our new director, who you all see at lunch today, she has meetups with Mandy, to where people have signed up, and she meets with like 10 to 20 staff once a week. I also try to do some of those kind of walk rounds and do employee lunches so that people see us out and about. There's certainly been a lot of challenges, and I think that's where I look to all of you to really help with the misinformation and to really rebuild the trust in CDC, because we've been there 24/7. We're not going anywhere, and we need all of you.
That's perfect. Which leads me to my last question about Dr. Cohn coming in. You had Dr. Walensky before that.
I've been through 7 CDC directors during my
Seven?
tenure.
Okay, 7 CDC directors. What have been the best not to pick on anybody, but I'm curious, what have been the best attributes of a CDC director? What are the things that work best, and what are the things you think CDC directors need to, if you were going to give them a quiet moment of advice about, don't do that, what are the pluses and minuses?
I think one is you do have to make quick decisions with limited information. We saw that during COVID as it was evolving quickly. I think risk communication is really important because you have to be able to communicate to the public in many different settings, to Congress, to a church, to a school. So I think that's really helpful. Certainly a scientific background, but you don't have to be down in the weeds. You don't have to know everything. I think you have to be somebody that can rely on a good team around them. I would also say have the big picture, because if you focus solely on COVID, you're going to miss that chronic diseases cause worse outcomes. If you focus solely on hepatitis C, you're going to forget that drug overdose and injection drugs are worsening the problem. So you have to have that wide span. So I would say really some scientific expertise, big picture, clear communicator, and decisive.
Sounds good. I'm sure we'll hear a lot of that at lunch today. We do have a few extra minutes, so if there's anything else we didn't quite get out there. You mentioned the East Palestine situation. I think it's fascinating. I think some of y'all have maybe read about the fact that CDC plays a role in helping oversee what's going on there. What are some of the key lessons when a CDC goes into any type of disaster like that, recovery? What do you all come in with? What do you try to take away? What do you learn from experiences like that?
I think what's great is people don't realize, we know HHS has regional offices. CDC doesn't technically have regional offices, but our Agency for Toxic Substance Disease Registry, or ATSDR, does. And so we were able to be on the ground quickly in East Palestine, and what complicated that was actually 2 regions. Ohio and Pennsylvania were 2 different regions, 2 different states, but we had our staff that were there. So what we learned was just really, one, how do you understand the situation both from an environmental aspect, but also the individual impact it has, because there's certainly a lot of fear. There's the unknown. So as quickly as you can communicate around, like, what are the chemicals? What are the long-term consequences? Are there long-term consequences? And then certainly there's just even trauma from the experience itself that both our staff might feel, but certainly the community. So working with the community around resilience, I think this is really a boots on the ground type thing. And we saw that too, like Uganda. We had country offices, and so when there was the Ebola outbreak last year, our staff were there before anybody else, and were able to quickly contain that epidemic. And so I think what we learn is working with the communities, listening to the communities, learning from them, and then providing the scientific data that we can and the evidence.
That's great. Well, again, we did it again. We finished this in under the time that I think was fully allotted. But when we do Atlanta Business Chronicle events, we always like to promise that we like to finish a few minutes early to give everyone time to stretch their legs, get another cup of coffee. Russ, I hope you're not going to be angry at us for wrapping up. Oh, he's giving me a thumbs up. So when I get a thumbs up from Russ when we're finishing, but there's also nothing worse than trying to stretch an interview beyond its natural course. So having someone like Dr. Howery in place at CDC makes me very proud that CDC is here in Atlanta. And she does such a fabulous job delivering their message. And I can't thank you enough for being here today. And let's give her a round of applause. I think we're done. Thank you.